Hi, I'm Alexis Burrows. I'm the Marketing Director of Doctors Hospital. My colleagues and I join You and Your Money every month to raise awareness of diseases, treatment options, and new offerings at Doctors Hospital so that you're empowered to make better decisions for your health and finances. On today's show, it's just me and my colleagues, and we're talking about all things imaging, from mammograms to virtual colonoscopies. Keep watching. This is You and Your Money.
You and Your Money is brought to you by Doctors Hospital Health System.
Welcome to You and Your Money. Again, I'm today's guest host, Alexis Burrows. Here with me is Dr. Manish Sharma, who's my colleague at Doctors Hospital and the Director of Imaging. Welcome to the show, Dr. Sharma.
Thank you, Alexis. It's great to be here.
You're here today to talk about the K. Larry Carroll Imaging Center and all of the services that we offer there. So for our viewers at home, we run services from mammograms to ultrasounds, CT scans, MRIs, and basically everything in between. So today we want to kind of touch a little bit on the educational side of it. So we want to engage our viewers and get them to understand some of the services that we offer. So we're going to start with CT scans. Very briefly, can you explain to our viewers at home what a CT scan is?
CT stands for computed tomography. A lot of people in sometime, I wouldn't say the recent generation, but there was a time when it used to be called CAT scan quite often, which was computed axial tomography. But actually, because the scanner technology has improved so much, we're not really doing axial scans. So CT is just computed tomography. What it means is essentially it's a sophisticated form of an X-ray. There is an X-ray machine inside the scanner, which is actually going around the patient continuously. And the image is acquired by a set of detectors. And it's very difficult for the human mind to comprehend, but there is trillions of data points which are being managed at the back end by sophisticated computers to produce an image. It's not the direct result of the X-ray. It's a lot of computation.
Okay.
That's why it is called computed tomography.
Right. So why might a doctor recommend someone to get a CT scan?
Well, CT actually it's reached a point where you can call it the forefront of imaging, because majority of patients with diverse complaints, head to toe, are best imaged on a CAT scanner because of its ability to give us the details, which is fine details, but also its ability to give us the details in a short period of time. So that speed of performance, as well as the information which you can get out of it, make it the mainstay of imaging for a majority of the patient presentations.
Right, and when you're talking about trillions of data points in a very short time, obviously we can see why that makes sense. People may have gotten a CT scan before, or heard of a relative getting a CT scan and hearing about contrast. So can you explain what the contrast component is of the scan and how that's performed?
Right. So normally, if you look at the human body with the composition across from fluid to bone, the soft tissue component of it, so to say, let's say your solid organs, liver, pancreas, kidneys, muscles, all of them actually what we call as the soft tissue spectrum. They do not inherently contrast between them. In the sense, if I just do a patient as a plain scan without contrast, then they kind of look very similar. What a contrast scan does is actually we inject a dye which is particular to the wavelength of the X-ray machine, and it is able to give us a better differentiation of different soft tissue components. So a muscle which enhances much less than a liver kind of allows us the distinction of liver from muscle, or spleen from pancreas. And based on the enhancement dynamics, we get a lot of information, especially about blood vessels as well, like the arterial and venous system. So contrast is a very good additional or adjunct tool to get finer details on the CAT scan or CT scan.
And I'm sure one of the questions that people are going to have at home is, what does the quality of the CT scans at Doctors Hospital look like in comparison to those from other local facilities that may be offering the same or similar services?
I'm happy to say that keeping up with the trend of how Doctors Hospital has been with regards CT technology. Going back in history, actually, the first scanner was installed in Doctors Hospital all the way back in 1982. But since then, we have had many iterations of upgrades. We have mostly stuck with Philips. Philips is one of the technology leaders in the CT space. As of today, from an upgrade which we had in recent past, 2017, we are at a 128 slice CT scanner, which is one of the most advanced scanners in the region. What 128 refers to is it's the number of sections it can acquire within one rotation.
And quickly, what would you say to someone who may be concerned about radiation when it comes to a CT scan?
A very valid point. We do not take a CAT scan lightly. And that's why most of the regulations world over speak to justification and optimization. It's essentially one of the tenets of any radiology department. We have to make sure that the exam which is being done is appropriate to the clinical complaints. We have to make sure that the risk benefit is analyzed so that there is a benefit to the patient compared to the small risk which may be from the radiation burden. And beyond that, also to optimize the entire process and technique so that you're getting the maximum information from the minimum radiation. So yes, it is always a work in progress because every patient is different. You cannot go by strict guidelines for as a standard. So, and I think that's where we really stand out. I'm proud that we have a constant presence of a radiologist in the department, probably I'd say from 8 a.m. to 11 p.m. So that's a whole a big spectrum where we have an in-house radiologist, and their ability to participate in patient care directly does make a huge impact on the overall radiation burden which one would have had.
Okay. All right. So obviously, another question people may have is, what's the difference between a CT scan and an MRI, and why may a doctor recommend an MRI over a CT in certain circumstances?
Very true. A lot of people get confused because they look so similar, the donut gantry and the table in between. But they are poles apart in terms of technology. An MRI has nothing to do with radiation at all. The technology for MR is actually very sophisticated, even more complex than a CAT scan. And it is basically working on the concept of the protons or the H plus ions inside the human body. So 75% of the human body is water. So there's a lot of H plus ions. So depending on how they react to a radio frequency pulse, and as they relax, they actually, again, very sophisticated computers take all these data points and produce an image. So there's no X-ray involved. It is actually working on radio frequency. So there's a huge difference there. And because of that, the way the image is produced on an MRI, it actually has better inherent soft tissue contrast. So like I told you previously, on a CAT scan, a liver and spleen may look very similar, and we have to give contrast. But on the other hand, in an MRI, because of the way it produces an image, there is a greater soft tissue contrast inherently. I can distinctly see muscle, liver, spleen, kidney, pancreas, all the details, very exquisite. But the only drawback there, I guess that's one of the reasons why an MRI is not the mainstay, is because of the longer duration of acquisition. So that's the only, I think, but we are reaching there. MR is probably catching up. A lot of new technologies there in the market. Sequences are getting shorter. And the patient throughput is almost reaching, let's say, 13 minutes for a brain scan, which is not too bad considering it used to be many hours previously.
I mean, I think the point that's coming across as you discuss, both the CT and the MRI is information is critical. And so the more information you can get from a scan, the more information can be provided to your physician to inevitably make better choices when it comes to what your treatment options are and what your care is. So we don't want to leave without talking about ultrasounds, because I know a lot of times people will hear ultrasound and think pregnancy, and that's kind of what it's known for. But can you talk about some of the other reasons why a person may need to get an ultrasound done?
Yeah, that's. I don't know why everyone thinks of pregnancy with an ultrasound, but I'm seeing more and more, even amongst the physician community, there's a greater uptake of ultrasound, and that's great news because it's one of your basic imaging, and like just next to X-rays. What it does is it's able to, without any radiation burden to the patient, give us all this real-time information about things happening inside the body. So how it works is essentially there's a probe which is sending out ultrasound pulses, and as they hit various tissue or organs, they reflect back, and that reflection contains information which is then processed by computers to produce an image. So there's no radiation involved, and because it's being done on the patient, you're actually getting real-time information as things are moving under it, or as things are, the blood is flowing under it. So it gives you information which is very unique and different from what a CT or an MRI would provide.
Right.
So like for gallbladder, gallstones is again very common complaint, kidney stones, and appendicitis, which is again a very common presentation for an acute abdomen in the emergency room. So in common scenarios like that, and even beyond that, for imaging the thyroid gland,
Right.
it's literally the best investigation to start with, as opposed to a CT or an MRI, because the price point is better, the information you get is fairly relevant, and it can then determine whether or not you want to step up the game to a next imaging modality based on what you have found.
Right.
So that's why it's a great imaging tool.
Yeah.
Probably within the next 6 months, we're going to have the technology to merge MRI and ultrasound images, especially for prostate cancer. It makes a huge difference. So, yeah, I'm excited about that.
Yeah, I mean, it's a lot of exciting information, and obviously sounds like there's a lot going on in the imaging space at Doctors Hospital. Dr. Sharma, we have to take a quick break, but we have so much more to talk about.
Great.
All right. You're watching You and Your Money. We'll be right back.
Doctors Hospital's pharmacy introduces a new spin on prescriptions called Pick Up Now, Pay Later. That's right, you can collect your medications first and pay after. How does it work? Step 1, submit a prescription online. Step 2, select the pickup site. Step 3, collect your medication. And Step 4, pay online within 14 days. For more info, call us at 242-302-4785 or visit us at doctorshosp.com.
Doctors Hospital is proud to announce the launch of our infusion center. This center is available for patients in need of IV hydration and nutrition therapy, blood products, long-term antibiotics, and specialized medicines for a spectrum of diseases across multiple specialties, including rheumatology, dermatology, gastroenterology, and endocrinology. We also provide the latest in therapeutic options for COVID-positive patients. Why choose Doctors Hospital? We provide quality, highly specialized care with Doctors Hospital physicians and trained infusion nurses you can trust. Seamless medication approval through our pharmacy and registration services, a safe and comfortable environment, cost-saving benefits with copay waived on medications for insured LAMP members, payment plans for the uninsured, and immediate access to emergency services. We're located at the Luton Building on Daswell Street. For more information, contact us at 242-302-3323 or email us at infusioncenter@doctorshosp.com. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Welcome back to You and Your Money. If you're just now tuning in, I'm your guest host for today, Alexis Burrows, Marketing Director at Doctors Hospital. Here with me today is Dr. Manish Sharma, Director of Imaging at Doctors Hospital, to continue our conversation about all things imaging. So in our first segment, we talked about a lot of technical information about the different services offered at the hospital. But now we want to get into a conversation about routine screenings. So we're going to start with breast cancer screenings. For people who are coming in to get screens in that space, there's a lot of different services that are offered, mammograms, 3D ultrasounds, so on and so forth. Can you explain for us, Dr. Sharma, what the difference between those scans are and the information that it would provide a physician?
Mammogram and 3D ultrasound are very important tools to diagnose breast cancer. the mammogram is able to give us information which is fairly unique, especially with regards calcifications. So a lot of cancers, especially ductal cancer, which is one of the commonest cancers, presents with just small calcifications within the mass. And that is, it's really fine. It's fine to the extent of literally 3 microns. We are talking about 3 into 10 raised to minus 6.
Oh, wow.
So they are extremely fine, and you need a very specialized imaging tool to be able to pick up that small calcification. And that's where the mammogram is unique. So it's a sophisticated X-ray with ability to resolve really fine calcifications. So because of that, mammogram is kind of the mainstay to start screening, but you then complement that with an ultrasound. And like I told you previously, ultrasound is a contact examination which gives you information right there and then. So depending on what you see on the mammogram, you are able to complement more, get more information about a particular area or a lesion using the 3D ultrasound. So together, they are a force to reckon. I would say they're able to pick up on an average 14 to 16 cancers in 1,000 patients. So that it's a very good way of using screening tools to optimize picking up cancer at an earlier stage.
So for someone who may be coming into the hospital for the first time to have a mammogram done, what are some things they should do to prepare for the exam, and then what can they expect during and after the procedure?
A mammogram in general is literally a walk-in examination. You don't really need to be fasting or anything like that. We prefer to be the women not to use any deodorants or anything like perfume or a spray,
Right.
because there can be particulate matter on that which will show up on the mammogram. And then you do want to be mentally prepared, because yes, there is breast compression involved, and you have to compress to a particular depth to be able to see those small calcifications, as I mentioned. So yeah, there's a bit of a discomfort there with the breast compression, but again, with the technology as it is now, you're able to do that in a much better way than it used to be done previously. And again, on that note, I would like to mention that probably within the next 6 month spectrum, we are going to move into one of the best machines in the market for breast imaging, which is called 3Dimensions, and it's able to give you information which it's very fine and resolved, and it can pick up cancers way earlier than they would have been picked up on the routine imaging screening.
Right.
So we're excited to be there.
Okay. So switching gears a little bit, the next screening we want to talk about is for colon cancer. So can you just explain for us, who is at risk for colon cancer and how often should screenings be done?
Okay, so again, colon cancer is one of the leading causes of cancer-related deaths world over. In the Bahamas as well, both men and women are susceptible. And what happens is beyond the age of 50 and definitely beyond the age of 60, you're going into that spectrum where small colonic adenomas or lesions which were formed because of a normal proliferation of tissues can undergo malignant transformation and form adenocarcinomas. So the idea with colon cancer screening is to be able to pick up these lesions in the adenoma stage before they become carcinoma. And even if they do become carcinoma, before they actually become bigger masses and metastasize. So you want to pick them up when they're in the treatable stage with least morbidity and mortality. So colon cancer screening, we in imaging are able to offer what we call as virtual colonoscopy, which is slightly different from the optical colonoscopy, which is done by the gastroenterologist in his office. We are able to do this because once you prepare the colon with a particular diet and medications, then you're able to empty it out completely. And an empty colon is then distended with just room air. And what you can then see is the entire wall of the colon and be able to pick up any lesions in it using the CAT scan. So that virtual colonoscopy is a very sophisticated, less invasive way of being able to pick up these lesions.
So we're going to move into the last topic for this conversation, and that's coronary artery disease. So can you just explain quickly what that is and why it's one of the leading causes of death in the Bahamas?
Oh, well, you've touched on one of the commonest causes here, and unfortunately, heart disease or coronary artery disease, with presenting with angina and cardiac arrest, is on the rise world over, and that's because of diet and exercise. Essentially, we are living in a world where we are so all confined to our comfortable spaces, and again, the diet is taken into us. COVID has been it really made things worse because we're not able to go out as much. And together with the genetics and the level of cholesterol in various people, depending on how their body manipulates what they eat. So all of it comes together that it's so common beyond 45 that you're going to start developing small plaques, which are blocking parts of your arteries. As the arteries get smaller, any small amount of lipid or cholesterol deposition is going to cause narrowing in the vessel wall or the lumen. So especially in terms of the heart, where the coronary arteries are supplying the heart, or in the brain where the carotid branches are supplying the brain, any such small plaque results in reduced blood supply to the heart or the brain. So they kind of together, you get coronary artery disease causing heart attacks, and you get carotid intracranial blood vessel disease causing strokes. Yes, the aim of coronary artery screening is using, again, a CAT scan, is to be able to pick up these stenosis or narrowings in the vessel and determine where they are, how big they are, what is their composition, are these something which can progress and cause this a heart attack, or these are something which you can manage with medication. And we're able to do that on the 128 slice scanner because of its faster speed. It's able to image the beating heart. So you can imagine the heart's going at 60, 75 beats per minute, and to be able to capture information which is time resolved and spatially resolved from a beating heart, you need sophisticated technology.
Right.
So the 128 slice is able to give that information on a beating heart, and we are able to do coronary angiograms quite successfully on most patients, and then pass that information off to the cardiologist to determine how to manage this.
And obviously, the last question with this is, how often should someone be getting screened?
For example, the three which we discussed, mammography is recommended annually. Most women beyond the age of 40 undergo annual screening. Most countries stop around 73 to 75. So that's the big window which you want to capture early cancer. With regards colon cancer and coronary artery screening, you're screening every 5 years because there's always a lead time for disease development to reach that point where it's going to cause catastrophic events. The adenoma carcinoma sequence in the colon is a long process. It doesn't happen quickly. So every 5 years is the recommended screening for virtual colonoscopies and for coronary artery disease.
Okay, awesome. This has been a wealth of information, Dr. Sharma. I want to thank you so much for joining You and Your Money today.
It was my pleasure, Alexis. Thank you for having me.
Up next, I'll be joined by Derica Wilson, Radiology Manager at Doctors Hospital, as we continue our discussion about imaging services, including pricing and scheduling procedures. You're watching You and Your Money. We'll be right back.
Doctors Hospital is proud to announce the launch of our infusion center. This center is available for patients in need of IV hydration and nutrition therapy, blood products, long-term antibiotics, and specialized medicines for a spectrum of diseases across multiple specialties, including rheumatology, dermatology, gastroenterology, and endocrinology. We also provide the latest in therapeutic options for COVID-positive patients. Why choose Doctors Hospital? We provide quality, highly specialized care with Doctors Hospital physicians and trained infusion nurses you can trust. Seamless medication approval through our pharmacy and registration services, a safe and comfortable environment, cost-saving benefits with copay waived on medications for insured LAMP members, payment plans for the uninsured, and immediate access to emergency services. We're located at the Luton Building on Daswell Street. For more information, contact us at 242-302-3323 or email us at infusioncenter@doctorshosp.com. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Doctors Hospital's pharmacy introduces a new spin on prescriptions called Pick Up Now, Pay Later. That's right, you can collect your medications first and pay after. How does it work? Step 1, submit a prescription online. Step 2, select the pickup site. Step 3, collect your medication. And Step 4, pay online within 14 days. For more info, call us at 242-302-4785 or visit us at doctorshosp.com.
Welcome back to You and Your Money. I'm today's guest host, Alexis Burrows. Joining me now to talk more about imaging is our radiology manager, Miss Derica Wilson. Welcome to the show, Derica.
Thank you, Alexis.
Obviously, Derica, this wouldn't be You and Your Money without talking about the financial aspect of, these imaging services. So can you just walk us through what sort of pricing discounts are available right now, or what pricing options are available for both uninsured and insured patients in the Doctors Hospital imaging space?
Yes. So for the insured patients, what we've done is we have waived the copay completely.
Mm-hmm.
For the uninsured patients, we've made some adjustments where to the cash price. So for MRI patients, we've lowered that price to $700 cash, non-contrast studies, and $900 for contrast studies. We've taken it down even further for the public health patient, where contrast would be $600, non-contrast is $400. We also want to remind persons that we're now offering Saturday appointments.
Mm-hmm.
Every ultrasound procedure would be cash pay, $250.
Okay. So obviously, with the pandemic, a lot of people have lost their insurance in the last 2 years. One of the things that we've done at the hospital is introduce our Loyalty Advantage membership program. And for those of you who don't know, it's a monthly payment program where you get access to discounts on Doctors Hospital services, lower prices on prescriptions, things like that. Derica, can you speak to the specific areas of imaging and what benefits LAMP offers for imaging patients at Doctors Hospital?
Yes. So we do offer, you will get one free CT or MRI for the year, as well as a mammogram. I think we've also included X-ray in that as well. So that's pretty comprehensive.
Right. If you're a LAMP member, even the self-pay pricing, you can kind of go even further down on that if you're a LAMP member and get, a free scan over the course of the year. And I'm sure that would be particularly helpful for a lot of people listening at home. Derica, the imaging service is available 24 hours for inpatients and for emergency services. But how accessible is Doctors Hospital imaging for outpatient services?
We have availability around the clock. We should be able to accept outpatients up until 11 p.m.
Well, thank you for all of this great information, Derica. I think you've walked us through a lot of really important information about the operational side of the imaging department at Doctors Hospital. I want to thank you for joining You and Your Money today.
Thank you.
For more information on our imaging services, you can call the K. Larry Carroll Imaging Center at 302-4662. Visit our website at www.doctorshosp.com/imaging or email us at imaging@doctorshosp.com. We would also like to remind the public about our new micro center at Carmichael Road next to Bahamas Christian Fellowship Church, offering lab services and rehab services and launching clinic services later this month. For more information about Doctors Hospital, you can visit our website, www.doctorshosp.com, follow us on social media, or call us at 302-4600. It has been a pleasure hosting today's show. Follow You and Your Money on social media and tune in next week for another exciting show. Thank you for watching.
You and Your Money was brought to you by Doctors Hospital Health System.